Good afternoon, everyone. It's 1 o'clock. It's afternoon. Thank you. My name is Patricia Tilley. I am the Deputy Director of the Division of Public Health here at the Department of Health and Human Services. And I am so pleased to be here today to be talking about something that is so important to me professionally as well as in my own life. We are thrilled that these awardees that are here today, and that Lisa will introduce in a minute, are extending efforts to address tobacco use and dependence among all of their very different and sometimes similar patient populations. I don't have to tell you that tobacco dependence continues to be the #1 preventable cause of disease and premature death in the United States at approximately 400,000 deaths per year, with an additional 50,000 deaths due to secondhand smoke exposure. You know, sometimes I feel like we say those numbers and they're just numbers. I can't almost think of anything else there is that impacts so many people, causes quality of life issues and death that we really aren't just raising the roof about. We've allowed tobacco to continue to be in our communities. And what I'm so proud about is that these agencies have really taken bold steps to address this so that while they're helping their patients get healthy through all of their different modalities, that they can have a long, really positive quality of life by addressing the tobacco. In New Hampshire, 18% of New Hampshire adults currently smoke, which is equivalent to 193,000 people. So way bigger than the city of Manchester, and a tremendous number of people. And although it's this next generation seems to be smoking cigarettes far less than they did 5 years ago, their use of other things like electronic cigarettes or the little cigars continues to increase significantly. Tobacco use dependence takes a staggering toll on New Hampshire's healthcare and economic systems as well. In New Hampshire, tobacco cessation efforts have had a positive impact on reducing the prevalence of smoking, and that's really why we're here to celebrate you today. It is now my pleasure to introduce Lisa Morris, who is the Director of the Division of Public Health Services, and she will talk a little bit more and let you have an opportunity to share your stories as well. So thank you, Lisa.
That sounded really loud. So, hi, I'm Lisa Morris, and as Tricia said, I'm the Director of Division of Public Health Services. I want to let you know that Commissioner Jeffrey Myers, who is our Commissioner of the Department of Health and Human Services, is so sorry that he couldn't be here today, and that he congratulates all of the award winners and really understands the depth around tobacco and the significance in terms of our health outcomes or our poor health outcomes for those who do smoke. So I'm pleased to be with you today to honor the awardees and to talk with you about tobacco and what we are doing in public health to impact tobacco use. As many of you know, tobacco dependence requires the same long-term chronic care management approach that is used in other conditions such as asthma, diabetes, and cardiovascular disease. This is not new information to healthcare providers. However, there are many competing healthcare priorities that need to be addressed during a patient's visit with their provider. One of the goals of the Tobacco Prevention and Cessation Program is to provide evidence-based tobacco treatment resources to New Hampshire residents, to healthcare systems, and to provide training and technical assistance to ensure the most efficient and effective utilization of these resources. Quit lines are considered by the Centers for Disease Control and Prevention to be an evidence-based strategy for helping people to stop using tobacco. Tobacco treatment quit lines are available in every state and territory in the U.S., in each Canadian province, and throughout Europe. I encourage all of you, if you haven't done so already, to visit the QuitNow-NH and the QuitWorks-NewHampshire.org websites as new information and resources are posted regularly. And of course, there is a toll-free number to access the quit line as well, and that you can access both websites from QuitNow New Hampshire. QuitNow New Hampshire is proud to offer high-quality tobacco treatment to New Hampshire residents regardless of their health plan or in the absence of a health plan or at no cost. These services are contracted through the National Jewish Health Hospital in Denver, Colorado, which is a renowned respiratory hospital. QuIT coaches receive hundreds of hours of training. They receive training in cognitive behavioral change and in motivational interviewing. Although they have this training, their conversations with the people that they're working with are not scripted. They talk directly to participants with meaningful discussion about quitting tobacco, obviously, and remaining abstinent as a life choice. QuitNow-New Hampshire offers a variety of resources for the general public as well as to general practitioners, medical specialty clinicians, substance use disorder counselors, mental health providers, and OBGYN providers. You know that investing in tobacco programming is vital. We know that for every dollar spent on tobacco programming relates to reduced health costs. We at DHHS recognize the contribution of you, of all healthcare agencies, or most healthcare agencies, in addressing the high prevalence of tobacco use in their patient populations. Today, we recognize 4 health systems for your hard work to improve patient access and provide effective tobacco treatment. So I'm going to list you individually, and if you would come up and receive your award and tell your story, that would be wonderful. So the first awardee is Dartmouth-Hitchcock in Lebanon for being the first hospital in New Hampshire utilizing electronic medical record transmission for referring patients to QuitWorks New Hampshire for tobacco treatment. I'd like to call up, or accepting the award, is Scott Tacker, the Systems Application Systems Analyst. Congratulations, Scott. We'll have you do your story first, huh? And then do you have a story to tell?
I don't have a story.
You don't have a story?
I'm the worker bee.
Oh, you're the worker bee. Okay. Can you tell us a little bit about the work that you did on your end to make this all happen?
Well, sure. So basically what we did is we were asked by the QuitWorks program here, how could we assist our patients facilitate in the referral process to the program. Because we were doing a lot of paper transmissions, referring patients to the website, handing them out pieces of paper, says call this, and there just wasn't that follow-up on the patient's side. So we started working with them, and we developed a process in our electronic medical record where the provider, once they identified that they were in need of a cessation program, that they would place a referral within our system, and it would electronically transmit from our system to the National Jewish program, and then they would follow up from there and then communicate back electronically to us as far as the status and the follow-up activities on that patient. So it was really nice that we saw a significant increase in referrals to the program and a very positive result from our patient and reduction in smoking. So, thank you.
Great job. So our next awardee is Midstate Health Center in Plymouth for being the first federally qualified community health center in New Hampshire to utilize electronic medical record transmission for referring patients to QuitWorks New Hampshire. Accepting for Midstate is Sarah Donahue.
I'm not involved in the program myself, but I was sent the information for all of you. Peggy Rosen, Midstate's Quality Improvement Coordinator, brought together a team which consisted of the medical director, now retired Dr. Fred Kelsey, our information technology person, Brian Morgan, and herself. They created a work plan that operationalized e-referral by December of 2015. TPCP covered the cost of the interface between NJH and Midstate, but our EMR vendor, EMDs, required some changes. These changes took much longer than anticipated, but testing the interface was successful in February of 2016. Training the Midstate clinicians was completed. However, the clinicians were resistant to the new workflow that increased their clicks during patient appointments. The previous workflow had moved patients identified with tobacco use disorder to the specialty nurse who conducted one-to-one tobacco treatment that included faxing patient referrals to QuickWorks, New Hampshire. During the EMR changes to accommodate e-referral, all staff except for the MD, DO, and APRN staff were locked out of the QuickWorks, New Hampshire interface field. This presented a significant utilization roadblock. Over time, this roadblock was identified, and Brian Morgan adjusted the security parameters within the EMR, which enabled the specialty nurses to e-refer patients again. In March of 2017, Midstate fully operationalized e-referral, and Midstate's average monthly patient e-referral is 12. In our efforts to keep our patients healthy, our patients and our community.
Oh, thank you very much. We're in this together. We're all in this together. The next awardee is Riverbend Community Mental Health Integrated Center for Health in Concord for treating patients holistically by including tobacco in their treatment plans with on-site counseling and nicotine replacement products from QuitNow, New Hampshire. Accepting for Riverbend is Katie Lipp, Program Director.
So in October 2015, Riverbend was awarded a SAMHSA primary behavioral health care integration grant, through which we were able to incorporate primary care and various wellness activities into our community mental health center, specifically in our program for adults with severe mental illness. And one of the things that we know to be true is that adults with severe mental illness use tobacco at a much higher rate than the general population. So I think you cited 18% is where New Hampshire is currently. Our enrolled clients right now are at about 50% tobacco use. So we recognize it as a huge area that we needed to incorporate some wellness programming. And one of the things that we really like about the evidence-based model that we took on, which is called Learning About Healthy Living, Tobacco and You, is that it has a two-pronged approach. One for people who are in more of a contemplation phase. That group is open. It's led by our peer wellness coach, so somebody with her own lived experience, and really allows for us to meet people where they're at. And then we have a second group that is targeted towards people who are in action phase. And we even ask them to get a contract signed by various people in their lives, 3 supports. That's really just their kind of declaration to their support team that they want to take some action towards quitting smoking. So at this point, we've had 35 clients engage in these programs, and we have 7 people at least that we know of who have sustained abstinence from tobacco. So we're seeing some great success, and we're really proud of it.
Good job. And lastly, but never least, the Greater Nashua Mental Health Center in Nashua for implementing tobacco-free policies at all 3 of their campuses, which resulted in patients and employees being treated for tobacco dependence. Accepting for Greater Nashua Mental Health is Susan Flynn, Manager of Nursing and Wellness.
Thank you. Thanks for having us here today. I've been at Greater Nashua for about 4 years, and when I got there, we had a couple of different research programs going on, and one was Breathe Well, Live Well. We had another part of a grant that was geared to young adults smoking decision making. And when those grants went away, I realized, okay, now we have nothing to offer our clients that really want to quit smoking. And we were allowing smoking all over our campuses. And our main building where we treat clients has this beautiful canopy with about a dozen steps to the sidewalk. And where do you think everybody gathered to smoke? Under the canopy. So it was really pretty gross to walk through that to get into our agency. And it bothered me for such a long time. And I'm also part of the risk management committee of our agency. And we would kick around the idea of what if we went smoke-free? And we were always in favor of it, but our leadership was changing. Nobody really wanted to make the big declaration of we're going smoke-free. Until this spring when our CEO, Craig Amos, and our medical director, Dr. Padeline Jung-Tyner, said, that's it, we're just gonna do it. So I'm like, okay, now after thinking about it for 2 years, now all of a sudden they wanna do it tomorrow. So I called Teresa, and she said, well, you know, I really wouldn't just jump right in. I'd probably try to make a plan. So she helped me create an implementation plan. And one of my stipulations was we're not going to implement this until we have something to offer the clients that want to quit smoking, and the staff, not just the clients. So we got involved with QuitWorks and QuitNow, and it's been a great resource. Our providers are having the discussion regularly with the clients. We maybe have had 26 clients that have come to get the free nicotine replacement patches and the lozenges, and it's been really successful. I don't have a sustained quitter yet, but definitely made some progress with the clients, and they're just really happy to be asked. They're happy to try. So it's been a really positive thing for our agency. So thank you.
So Tricia and I want to thank you all for coming today to celebrate these successes. It's amazing to see the progress that we've made, but we have a long way to go. So as ambassadors of this great work in tobacco cessation, please share your successes with others in your field and out in your community, and your community partners, so that we can spread the word and get more people to utilize the Quit line, and most importantly to stop smoking. So thank you very much, and congratulations to awardees. Have a wonderful afternoon.